welcome to another episode on Health Talk with Fifi. With your host Ajua Duma Ansah. Thank you so much for today and for your time. Let's look at obesity. Before we do that, let's recap ourselves. Stay tuned. We'll be right back. Now let's look at postpartum psychosis and what it's about. Have you ever encountered a woman few weeks after birth and showing signs of not wanting the baby? Have you encountered a sister or auntie after birth and not having the urge to breastfeed the baby, even thinking of harming the baby or regretting of giving birth? Have you ever encountered that? Have you ever encountered a woman feeling like the spouse, the family or friends are showing much attention to the baby instead of her? That is what we term as postpartum psychosis. So it's a rare. So obesity, let's look at obesity. Obesity is a medical condition whereby there is excessive accumulation of fat in the body to the extent that it has a negative effect on the person's health. Yes. So when your body there is excessive accumulation of fat in the body, we call it obese. You are obese or obesity. To the extent of harming the body, your health, having effects on your health, you call it obesity. Okay, so obesity, it can be measured by knowing your body mass index, BMI, as we simply call it. So this is whereby your height and your weight is being measured and multiplied. And if it's more 30 and above, we can say you are obese. Yes. So some causes are genetic, some also are environmental and lifestyle, and the environmental and lifestyle is the most common in 80% of the cases. People eating lifestyle, eating late at night. People eat as late as 10, 11, and you will see them eating foods like banku, fufu, spaghetti, those heavy food at 11 p.m., which is very bad. You can be at risk of being obese. And when you are obese, do you know you are at risk of having a heart problem or heart disease? Do you also know that you are at risk of developing type 2 diabetes? Especially people who eat late at night. Do you know you are at risk of having type 2 diabetes? You are also at risk of having certain cancers when you are obese. Sleep apnea. Eating that late, how are you going to sleep? Joint pains as well. So when you eat at night or when you are obese, you are at risk of having all these conditions: heart attacks, certain cancers, sleep apnea, joint problems or joint pains, or type 2 diabetes when you are obese. Now, how do we prevent or how do we treat this? Good lifestyle and eating well. Make sure you are exercising regularly or regular exercise. Eat well. Be on a balanced diet and taking a lot of water. That is all. Make sure you don't eat late at night. You are always eating on time, so the body also has enough time to digest the food before you go to sleep or you go to bed. So make sure you have a good lifestyle. You are eating a balanced diet, a lot of vegetables, and drinking more water. Then also you avoid alcohol and smoking or taking tobacco. When you do that, you are free. There's no way, or you are not at risk of having obesity, or you are not at risk of being obese. So this is the end of today's video. I hope you've learned a lot. We've looked at obesity, what it is, and the cause, and some risk factors and prevention tips. I hope you are taking this into consideration. Have a good day. Bye.